Is hair loss always genetic? Can lifestyle factors contribute?
So when we take a deeper dive into genetic hair loss, for 97% of men that have a hair loss concern, it is genetic. For women, it's around 40 to 50%. But as stated earlier, genetics isn't the only reason why we actually have genetic hair loss. There are about 287 genes that work together to create hair loss. We also talked about age being a risk factor, but the big one that is not talked about enough is epigenetics. Epigenetics is essentially what we do with our lifestyle and environmental factors that dictate how our genes are expressed. So you can have a patient who has genetic hair loss on both sides of the family, but they're not necessarily going to have the exact same hair destiny as what they're seeing in their elders. If you treat your body better, there is research that shows that your genes will be less expressed. So when we talk about lifestyle factors, we're talking about the basics: how we sleep, how we treat our body with food, alcohol, tobacco, and also just in general, are we working out? Are we able to eat healthy foods? Because we do know that we are what we eat. If we think of hair as an organ, it is one of the most sensitive organs we have, but it isn't the most pivotal. When we eat, our nutrition is going to go to the more vital organs: your brain, your kidney, your lungs, your heart. So think of the hair as more down the line. It's going to get whatever's left over. So when we are eating, it is always best to follow an anti-inflammatory diet, rich with a balance of protein, carbohydrates, and fats. And the best diet overall is going to be a Mediterranean diet. The anti-inflammatories and the antioxidants in there will help calm the skin as well as calm the entire body. And then having these good fats and these good proteins, they're all going to contribute to the richness of what your hair is going to consume.